Hey everyone, welcome back to another lesson. This lesson is on social anxiety disorder. So in this lesson, we're going to talk about what this condition is. We're also going to talk about some of the risk factors for getting this condition. We're also going to talk about some of the hypotheses behind why this condition occurs. We're also going to talk about some of the signs and symptoms, how we can diagnose it, and how we can treat it. So social anxiety disorder is also known as social phobia. It is a chronic disorder, often referred to as a chronic phobia disorder, involving fear and anxiety of social situations and interactions. We're going to talk about some of the different social situations and interactions that cause anxiety in these individuals later on in this lesson. So what is the epidemiology? I want to talk about the epidemiology here. Why the epidemiology is important here is because the lifetime prevalence of having this condition is estimated to be upwards of 12%. So this is actually very, very common. It's actually one of the most common psychiatric conditions to affect people. And it has an onset usually in adolescence. So we find that it occurs in mid-teens the most often, but it can also happen in early childhood as well. And what is interesting here too with regards to the epidemiology is that there are higher rates of social anxiety disorder in developed countries versus developing countries. So in developed countries, when we look across developed nations, we find that the rates are very steady. They're actually very comparable, and they're higher than when we compare rates to developing countries. So again, very interesting. So what are some of the risk factors for having social anxiety disorder? So the risk or influencing factors for getting this condition are as follows. Number one is being of the female gender. So females seem to be at a higher risk of getting social anxiety disorder than males. Another risk factor is having a family history of social anxiety disorder. So this can tie into possibly a genetic component or an environmental component. We're not really sure right now. The genetics behind this haven't really been elucidated at present. The third risk factor is being shy during childhood. So having a temperament where you're very shy as a child can lead into social anxiety disorder. It might not, but it could lead to having social anxiety disorder. Another one is having a temperament, again, usually in children or as a child, having a temperament that is behaviorally inhibited. So what does that mean? That means that you have inhibition when you are socially interacting with your peers or with others. So you're not really free or you're not really yourself when you're around others. So you have this inhibition. The fifth risk factor is difficult and unpleasant experiences during early childhood. So these can be anywhere from abuse to something that happened traumatically during childhood. Oftentimes it's early childhood, and this can increase your risk for getting social anxiety disorder as well. Another risk factor has to do with your personality. So certain personality or personality traits that have that individual being more prone to be negative. And when I say that, I mean that they look at themselves in a negative view, and they are hyper-focused on negative evaluations and negative stimuli. So they have a very low self-esteem. They may look at themselves as, not very adequate in social environments, and they seem to be hyper-focused on negative evaluation. So if someone says something critical or even minor criticism, they can take that very sensitively. Another risk factor is growing up with overprotective or overcritical parenting. So very interesting, and we could see this being tied in with the fifth risk factor, difficult or unpleasant experiences during early childhood. So all of these factors can increase your risk for getting social anxiety disorder. And once you have social anxiety disorder, the condition of having it will increase your risk or is associated with other types of medical and psychiatric conditions, such as major depressive disorder and substance abuse disorder. So having social anxiety disorder itself can increase the patient's likelihood of having these other conditions. And that makes sense because if a patient with social anxiety disorder is not able to develop social relationships properly, it can lead to a lower quality of life and lead to depression. So they can get major depressive disorder. And some of these individuals, because of the anxiety they experience in their social situations or social interactions, will lead them into substance abuse like alcohol to help reduce some of that anxiety. So we can see these types of psychiatric conditions like major depressive disorder and substance abuse disorder in patients with social anxiety disorder. So I want to quickly talk about the pathophysiology of social anxiety disorder. Some of the hypotheses for why this occurs include the following. One is that there's this question of, is there a dysregulation of serotonin or a dysregulation of serotonergic neuronal activity? And what we do see is that depletion of serotonin may increase autonomic arousal. So this may increase having feelings of agitation and anxiety. So that might tie in with this condition. Another hypothesis is that social anxiety disorder may be caused by increased glutamate levels. And another one may be that social anxiety disorder is caused by an increased hypothalamic pituitary adrenal axis functioning. So increased HPA axis functioning increases stress hormones like cortisol. So this could be a potential cause for social anxiety disorder. And researchers have actually looked at the brains of individuals with social anxiety disorder, and they find that there's an increased activity in limbic fear circuits and increased activation of the amygdala. The amygdala is, we can think of it as the fear center in your brain. So what are some of the symptoms of social anxiety disorder? So really the key here is that there's excessive fear or anxiety in situations involving public performance or social interactions. That is key to this condition. And they have excessive fear in these situations, and it's really fear of certain things. They have a fear of embarrassment, or a fear of scrutiny, or humiliation, or social inadequacy, or rejection, or being perceived as very anxious, or some other negative evaluation. So they are afraid of public performance or social interactions or social situations because they're afraid of these things. They're afraid of being embarrassed. They're afraid of scrutiny, humiliation, appearing to be socially inadequate, fear of rejection, being perceived as very anxious, or some other negative evaluation. So there's some fear that is preventing them from being very open or very social with others. So this excessive fear or anxiety can occur in different situations. So it can occur in novel situations. So if you go to a place you've never been before, or you're doing something that you haven't done before, it can occur when you're around unfamiliar people, so somebody you don't know. Or it can occur with familiar people, people you do know, but there's some evaluation component in that social interaction. You're afraid of being negatively evaluated by your peers, even people that you know very well. This can lead to excessive fear and anxiety. And this can all lead to the following. It can lead to clinically significant impairment in a patient's life, like decreased social support because they're not able to make and maintain those social relationships. They're less likely to become married because, again, they're very afraid of perhaps dating other people. And they also have higher rates of suicidal ideation and suicide attempts, and a reduced academic and occupational functioning and attainment. So because of all of this, because of this excessive fear and anxiety in these different types of interactions, in these different public performance situations, like public speaking or doing a presentation in school, they have this excessive fear and they're not able to do it. And this can lead to many problems in a person's life. So decreased social support because they have less friends and they're more afraid to interact with other people and make new friends. They are less likely to be married because they may be less likely to go on dates and are very anxious about talking to new people and talking to new potential partners. They may have higher rates of suicidal ideation and suicide attempts because they have decreased social supports. They're at an increased risk of major depressive disorder, like we talked about before. And because of what I said before, they're less likely to connect with others. They're less likely to be able to perform well in public performance aspects. They may have reduced academic and occupational functioning and attainment as well. So how do we diagnose this condition? We have to look at the DSM-5 criteria. So all of this is adapted from the DSM-5. So we first look at the A criteria. The criteria A is what we need to have. If we don't have this, we don't even have to look at the rest of the criteria. So criteria A states that there is marked fear or anxiety about one or more social situations that exposes an individual to possible scrutiny by others. Examples include social interactions, having a conversation, meeting unfamiliar people, being observed, eating or drinking, and performing in front of others, giving a speech. So I'll unpack that a little bit. What's key here is there's marked fear or anxiety. So it's very significant fear or anxiety. And it doesn't have to be necessarily in multiple situations. It can only be in one social situation. But most of the time, it's going to be multiple situations that exposes that individual to being evaluated in some way. So, or their perception of being evaluated in some way. So certain social interactions, like having a conversation, they may think people are looking at the way they're talking or the words they're using. They have issues with meeting unfamiliar people, usually due to the same reasons. And it doesn't even necessarily have to do with talking to other people. It can just be being observed. So if you're in a restaurant eating or drinking, that person could have some issue with anxiety about being with people there because they think those other people are going to look at them or perceive them or evaluate the way they're eating or drinking in a negative way, and performing in front of others. This is very, very common, being afraid of public speaking, but this is to the extent that it's very marked fear or anxiety where it's affecting the way they're living. So this is what happens in adolescents and adults, but in children, we have to see that the fear or anxiety must occur in situations of social interactions with their peers and not with adults. So children have to be very fearful or anxious when they're talking to or socially interacting with kids their own age, not talking to or interacting with adults, because that can be common for children to have some anxiety when they're talking to adults that are strangers. The B criteria. So once we have the A criteria, we move on to the B criteria. The B criteria states that the individual fears that he or she will act in a way or show anxiety symptoms that will be negatively evaluated, will be humiliating or embarrassing, will lead to rejection or offend others. So that kind of basically expands criteria A. That individual fears that they will act in a certain way. They think that they're being watched or evaluated in a certain way, or they show some anxiety symptoms. So as we talked about earlier, they are worried or fearful that others think they're very anxious as well. That can also be a component of this. And they think that they will be negatively evaluated, so humiliated or embarrassed. And oftentimes what it really boils down to is they're afraid of being rejected or offending others. The C criteria is the social situations almost always provoke fear or anxiety. So that's a key here. Not only certain times, but it's almost always that the same type of social situations provoke fear or anxiety. In children, the fear or anxiety may be expressed by crying, tantrums, freezing, clinging, shrinking, or failing to speak in social situations. The D criteria, so once we move on past the C criteria, we look at the D criteria. The social situations are avoided or endured with intense fear or anxiety. Again, very key here. A lot of times individuals are afraid of public speaking, but they still do it. They still are able to function and do it well. But individuals with this condition, if they have an issue with performance situations like public speaking, they often will avoid those situations entirely. And that becomes very dysfunctional for them because certain parts of your life require public speaking or certain presentations. So this can affect their life. Or they really do it, but they're very, very fearful or very anxious during the situation. Criteria E is that the fear or anxiety is out of proportion to the actual threat posed by the social situation and to the sociocultural context. So this is basically saying that, if there is something very threatening in a situation, in some kind of social interaction, having heightened anxiety might be normal. It might be okay, but with this criteria, we're saying that the fear or anxiety is out of proportion to the actual threat or the actual situation. Criteria F is that the fear, anxiety, or avoidance is persistent, typically lasting for 6 months or more. So this is the time component. We need this to say that we have social anxiety disorder. So we have all the rest of it, but we also need to have this time component where they have this persistent fear, anxiety, or avoidance of certain situations that lasts for 6 months or more. Criteria G is that the fear, anxiety, or avoidance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. So this is what I like to call the clinically significant criteria. So when you look at psychiatric disorders, they have this type of criteria saying that their symptoms cause clinically significant distress, dysfunction, or impairment in your life, because these symptoms really have to cause something bad to happen in your life, like you having some kind of impairment or distress in your social life. So with your relationships, if you're not able to make relationships or make new friendships or maintain your relationships because of this anxiety, well, that's a disorder. If you're not able to hold on to your job or you're not able to go to work because of these symptoms, then that is a disorder. If it causes distress, dysfunction, or impairment in those aspects of your life, then it is a disorder. Criteria H is that the fear, anxiety, or avoidance is not attributable to the physiological effects of a substance, like a drug of abuse or a medication or some other medical condition. So this is what I like to call an exclusion criteria. So we basically have to say that we looked for other causes of these symptoms, like something they're maybe using for medication or some kind of drug or some other medical conditions that causing a lot of anxiety. If there's any of those, then this is not really the condition. This is not really the disorder that is occurring. There's something else causing these symptoms. And criteria I is that the fear, anxiety, or avoidance is not better explained by the symptoms of another mental disorder, such as panic disorder, body dysmorphic disorder, or autism spectrum disorder. So that is another exclusion criteria. This is the psychiatric disorder exclusion criteria. If there's another psychiatric condition that better explains the symptoms that the patient is having, then it is not social anxiety disorder. It's actually the other psychiatric condition that's causing these symptoms. And the last criteria is criteria J, stating that if there is another medical condition like Parkinson's disease, obesity, disfigurement from burns or injury is present, then the fear, anxiety, or avoidance is clearly unrelated to those medical conditions or is excessive. So what that means is that this is another exclusion criteria and states that if a patient has one of these medical conditions, it is assumed that they're going to be very self-conscious about the way they look or the way they're acting or the way they're carrying themselves in social interactions. So in order for them to have social anxiety disorder, they also have to have fear, anxiety, or avoidance, those symptoms we've talked about before, that is unrelated to these medical conditions, or is excessive. So they are expected to have some anxiety about some evaluation from others, but it's excessive. It's more than what would be expected. And I also want to talk quickly about the specifiers in this condition. There are actually two types of social anxiety disorder. There's type 1, which is social anxiety disorder. You can think of it as the general type. So this is really what we've talked about mostly in this lesson. They have social anxiety symptoms in a variety of social situations. So they can have it in normal social situations and performance situations like public speaking. And type 2 is social anxiety disorder, performance only type. And that is really where they're only having these symptoms during performance situations like public speaking. So again, if they have excessive fear or anxiety in all sorts of different social situations like normal social situations and interactions and performance situations like public speaking, then they have what we call just social anxiety disorder. If those symptoms aren't present in normal social interactions but only occur in public speaking or some other performance situation, they have social anxiety disorder, performance only type. So how do we treat this condition? So treatment involves looking at which type of social anxiety disorder they have. So with regards to social anxiety disorder, the general type, we can do psychological treatments like cognitive behavioral therapy. This could help with social anxiety disorder performance type as well. And we also look at pharmacological treatments. These include the SSRIs, selective serotonin reuptake inhibitors like paroxetine, sertraline, or fluoxetine. And we can also look at using SNRIs like venlafaxine or Effexor if the SSRIs don't work. And if the other ones don't work, we could look at using MAOIs, monoamine oxidase inhibitors like phenelzine. What's interesting here is that we see that about half of the patients will respond and have full recovery from treatment. And when we look at social anxiety disorder performance type, it's really not in all social situations. It's only in those performance type of situations like public speaking. So we can use other types of medications in acute situations that are very temporary. And these include beta blockers. So if they have issues with shaking or trembling during public speaking, we can use a beta blocker, or benzodiazepines as well that can help reduce the anxiety that they're having right at that moment. So again, these medications are for acute situations only, not to be taken chronically or continuously, only for very short amounts of time, usually when they have some kind of a performance-related situation. So I hope you found this lesson helpful. If you want to learn more about other psychiatric conditions, please check out my psychiatric playlist. And if you haven't already, please consider liking, subscribing, and clicking the notification bell to help support the channel and stay up to date on future lessons. And as always, thank you so much for watching, and hope to see you next time.